Thank you, Mr. Utaya. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon to Dr. Rosli and to all my friends. My name is Rosmawati binti Muhyiddin. Today, I want to continue my group presentation. So, this is Act applied by Aadk. In Aadk, we use Akta 283, Akta Penagih Dadah, Rawatan dan Pemulihan 1983, Amendment 1998. To that end, the Act was created to maintain ethics between officer and client, as well as ensure the law is complied with. In Section 20, 1A, B, C, and D relate offences by detainees in rehabilitation center and advanced personal care center and person undergoing supervision, or we call orang kena pengawasan. If the client commit an offence and if convicted may be fined or imprisoned for a term not exceeding 3 years or both. Punishment will be imposed on them. Duties and responsibilities of rehabilitation officer. Rehabilitation officer refer to subsection 2. 1. Supervision of all related matter with the arrest, treatment and rehabilitation of drug addict below this act, and shall be appointed a number of rehabilitation officer required from time to time for the purpose of this act. And the next, police officer or rehabilitation officer have the power to detain suspected drug addict under Section 3 of the Drug Addict Treatment and Rehabilitation Act 1983, Amendment 1998. Agency officer have power equivalent to police officer with the rank of Inspector of Royal Malaysia Police. This is an informed consent form, or we call borang persetujuan termaklum. This form requires a signature by the client and counsellor before begin the counselling session. The purpose is to ensure that the ethic of confidentiality can be adhered to and to pass information to others if there is something illegal. Those involved in drug addiction are linked to legal misconduct such as attempted robbery, rape, and so on. This form is very important and can be advanced in court. Okay, these are emerging issue in counseling Aadk. We go to first point, limitation of expertise. Client in dual diagnosis category require an integrated rehabilitation plan involving psychiatric consultation. Counselor do not have the necessary skill and professionalism to handle such case. Referral to a psychiatrist had to be done to treat the psychiatric problem experienced by the client before engaging the client with his or her psychosocial recovery program. The issue becomes more difficult when the client does not want to be referred to a psychiatrist. Client facing psychiatric issue in addition to billing drug is a difficult problem and challenge to deal with counselor. Now, Aadk has a special rehabilitation center for dual diagnosis at Tampoi Rehabilitation Center in Johor. So any client who have a dual diagnosis of symptoms should undergo treatment and rehabilitation there. There is treatment expertise from both angles. Aadk and Tampoi Hospital have a collaboration to address this dual diagnosis problem. These constraints of expertise occur when the client is in community supervision district Aadk. Counseling is a key element and tools in drug addiction rehabilitation. The needs for professional training to this service providers to ensure more service quality and effective. Okay, the second point is no supervisory system and systematic monitoring of the quality and standard of counseling. In Aadk, counseling is a main topic to be researched and refined. This is in line with the Will a Counselor Code of Ethics that determines the quality of service counselor are enhanced and improved through supervisory method and continuous monitoring. The system will also ensure a more appropriate diagnosis and intervention process and effectively can be carried out, which of course will be able to avoid from the occurrence of diagnosis and inappropriate therapy. So far, no specific monitoring has been done at Aadk to rehabilitation officer who conduct counselling session, such as the board of counsellor, which require CPD point for the evaluation of a counsellor performance. And the third point is the client's dependence on the counsellor. Strong social support typical of those who are important in the life of such client, family member, non-addicted peer, employers and so on. The lack of social support will make it difficult for client to the problem of resuming his affected social relationship and in turn can trying each individual to achieve recovery. The boundaries of the counselor and client relationship are mistaken for causing the client to depend on the counselor. The client is so dependent on the counselor that he cannot stand on his own to solve his problem. Okay, and the fourth point is workload and responsibilities more than is supposed. Counselor not only have to deal with the number of many cases exceed the specific ratio, but also burdened with a variety of additional tasks that sometimes loses his focus to carry out his essential duties. Effort to help the client cannot run perfectly and effectively if it continues. Counselor or rehabilitation officer have various branch of duties. Example, treatment and rehabilitation in unit rehabilitation officer. Second, enforcement unit as a enforcement officer. And third is prevention unit as a prevention officer. Rehabilitation officer cannot concentrate on the counselling session alone, having to complete other tasks related to prevention and arrest. There is no space specialization of tasks. This cause counseling session to sometimes fail to run as they should. Next, I will pass to next presenter, Mr. Pradeep. Thank you from me.